It's an honor for me to be here today, and I've been asked to talk about something that I think is very important to you young physicians, soon-to-be physicians, and existing physicians in your practices. Today I'm going to talk about therapeutic gardens, and to do this I've organized the talk into 3 questions. The first question that we'll address: are all gardens therapeutic? I get this question all the time when I'm lecturing to different groups, and so I think it's very valuable for us to think about therapeutic gardens in a very broad sense. Gardens produce all sorts of life-enhancing activities. We just don't think about them quite in this kind of structured way, and so I'm presenting to you some of the benefits that I think fit very well into today's integrated medical models. I like to use the Herbert Benson model that came out in 1994. I know it's a little bit old, but it's very simplistic in thinking about the 5 dimensions that contribute to human health. If we line up those different types of activities or their principal purposes for having a garden, you can see that they match very well and integrate into these 5 dimensions of human health. And I think this is very important because those gardens can really serve some very significant therapeutic roles in the average citizen's daily life. The first is they promote active lifestyle. They address obesity. They increase the ergonomic activities you saw just a minute ago. They reduce stress, provide opportunities for us to nurture, which I think is very significant for human beings. They allow us to take a proactive stance on our own health maintenance. And they really are an important form of backyard medicine. Lastly, they're very cost effective. An average garden, such as we see here on our left, would cost between $2,000 and $20,000 to create or to build. It would have a life expectancy of from 10 to 20 years. That ICU stay, in comparison, for 10 days, at $10,110 on average per day just for the room, would equate to 3 to 4 times that investment in a garden stay. It's substantial. So this leads us to the next question: are all therapeutic gardens equal? And I'd like to have you think about this just a minute. We just talked about the common garden, and I like to think about it with a small t. And it's a small t because it creates small incremental changes related to health on an individual basis that, if we amass these or aggregate them for society, will have huge impacts on healthcare costs in the future. Now let's look at a different type of therapeutic outdoor garden, okay? This one I call the therapeutic garden, capital T. This is the garden that's on steroids, okay? Therapeutic gardens, professionally designed, should target specific patient populations. They tend to occur in institutional settings. They parallel standard treatment protocols. They facilitate certain treatment outcomes in a patient group, and they are appropriate for both palliative care as well as rehabilitative needs. So those were the 5 guidelines directed by the professional group for therapeutic garden design just a few years ago. And the reason they were established was that there was great confusion about what was a therapeutic garden. We saw some of the benefits that were being produced by the common garden, and many people were saying, well, geez, isn't a meditative garden as healing as a therapeutic garden, as a healing garden. So this confusion was addressed by these definitions. And it was done so that the professional work that was being created would be focused, and it began to set the stage for performance standards and the quality of the design products that were coming out under this particular specialty field. Therapeutic site design is only 30 years old as a specialty form of design. It was instituted by this article that came out in Science magazine, which basically talked about the effect of the view from the window of cholecystectomy patients that were hospitalized in a given hospital where the study was being conducted. Half of the patient group were placed on the side of the wing that had a view to the mechanicals of the hospital. The other group were placed in hospital rooms that had a view to nature. And what Roger Ulrich found in the work that he did, which covered almost 10 years of studying nursing records coming off of this particular ward in the hospital, was there were significant differences between patient groups that had a view to nature and a view to the mechanicals. And the 4 parameters that stood out in this study were the health effects on the patient and the discharge time, the number of analgesics that were being taken, and the number of complaints that the staff had to endure from the patient group on this particular wing, with significantly different changes in those variables to the betterment of the patients with the view to nature. Conclusions, post-occupancy evaluations, and patient-based health variables, really essential if design professionals are going to build an evidence-based design in the future. That type of information will help us set, as designers, performance standards that are based on site characteristics and patient outcomes. Without it, we will never really be able to move this type of site design from simply an art to a science. So in conclusion, are all therapeutic gardens equal? They are, and yet they aren't. We saw what the small T common garden can provide us in terms of therapy. We're still in our infancy in the capital T therapeutic garden because we need to establish standards of performance and practices that ensure when we interface with you, the physicians of the future and the physicians of today, they're achieving the outcomes and they're facilitating the treatment protocols that we want for those patients. So that gets us down to the last question: how can medical practitioners improve therapeutic garden design? Take time to clarify with the design professionals that may be working in your institutional setting to create these landscapes that are designed for therapy, so that we know the treatment protocols and outcomes that are absolutely essential to allowing a patient group to be served in an optimum capacity. So together, I think we can be a great force of change. Designers, medical practitioners, Mother Nature, kind of a new way of thinking of a ménage de trois, by working together and producing landscapes that really do deliver therapy with a capital T to our patient groups.